So what I want to do is kind of go over the kind of status of COVID-19 in our county, where we're at now, talk a little bit about the state's plans for reopening, and go into more detail about the vaccines, how they work, who's eligible, how you get a vaccine, questions about vaccine side effects and things. First of all, this is all about public health, and public health, it's really the science of protecting and improving the health of entire populations. And so, traditionally public health was focused on infectious diseases because they had such a big burden on the health of the population. But now public health also focuses on other things that affect the health of populations, like air pollution and tobacco smoking, and physical inactivity and diabetes and things like that. But now back with COVID-19, we're kind of back to the roots of public health, which is trying to combat infectious disease. And in the state of California, the local health officer plays a big role in this. It's built into the California Constitution, the role of the local health officer to be able to act in terms of a health emergency, whether it's a measles outbreak or a tuberculosis outbreak, or in this year, it's been the COVID pandemic. And so the local health officer has a lot of authority to take measures to protect the public health, including requirements on businesses and individuals. As local health officers, myself and others, we try not to really work alone in a vacuum. We're always more effective when we work together. And so we've tried to work regionally. There's a group called the Association of Bay Area Health Officers, where health officers across the Bay Area counties, and that's the group that really worked together, in last spring to issue the first, really first in the nation stay-at-home orders to really try to flatten that initial curve of the spring waves. We also try to work at the state level through the California Department of Public Health and the state health officer. The state sometimes doesn't move as quickly as needed, which is why, in each of these 3 waves of COVID we've had so far, myself and the other local health officers have acted quicker to put in restrictions to try to slow the spread, flatten the curve, decrease the size of each wave before even the state took action. And I think that the Bay Area has done well as a result. The death rate in our county is about 1/3 or 1/4 what the death rate from COVID is on a population basis across the nation, or even as the state of California as a whole. So we've been doing a better job in keeping cases down and then keeping down the hospitalizations and deaths, and preventing the hospitals from being overwhelmed like they were in New York last spring, or that they were in Los Angeles this past winter. So looking at where we are now in Contra Costa, we're at a low case rate. Our adjusted case rate is 4.8, where it was in the 20s, 30s, even up to 40s over the winter. Our test positivity rate is down to 1.7%, and we were well over 10% in the winter. And our equity metric, which is our test positivity rate in our hardest hit communities, is down under 3% as well, and we're trying to get that even lower. And we've administered over 800,000 doses of COVID vaccine in just essentially 4 months since we started rolling out the vaccine in late December. And if you look, this is a graph of the test positivity rates. The green is the county as a whole, and the blue is the measurement in our hardest hit communities. We define it as this healthy places index. It's a bunch of different metrics based really that measures poverty and poor health status, and it tracks with the communities that were hardest hit by COVID. And you can see both of those graphs. We had a big spring surge that came down. Then we had our summer surge as we were trying to reopen up businesses, and they had to again close them down again with the institution of the state's color-coded blueprint tiers. And then we had our most deadly winter surge, where we had our highest rates of hospitalizations and deaths over the winter. And now we're coming down, to levels where we were at last September, October, as far as our test positivity rates. And our case rates are also down to those kind of lower levels. But if are we now facing a fourth wave? So, we can see across the country in places like Michigan, New York, New England, Florida, cases are rising, and some places rising pretty steeply. And if you look, this is just the kind of blow up of the tail end of our graphs. We can see we're kind of flattening out on the case rate is kind of leveled off, and our test positivity rate has leveled off, and our hospitalization rate. So we've been running around 30 people in the hospital for the last 3 weeks. It's stopped going down. So as every time in the past after kind of a major holiday and there's more social gatherings and get-togethers, we've seen cases rise again. And so are we on the verge of that, or are we going to escape what the rest of the country or parts of the rest of the country are experiencing? And will the vaccines really spare us from that? Another way of looking at it is something called the R naught. The R naught is a measurement of, and it's a kind of statistical calculation of, for each person with COVID, how many other people do they infect? And so if that number is less than 1, it means for every person with COVID, on average, they're infecting less than 1 person. And over time, that the epidemic, the numbers should decrease. And the epidemic, if that number can be maintained less than 1, eventually the virus would die out. If it's over 1, it means each person is infecting at least 1 person, or maybe more, and exponentially the numbers are just going to grow. And you can see, at each of our waves that R naught was over 1, and then we got it down below 1 for a period of time before it started going up again. Well, if you look where we are now, and on the right, it's kind of blowing up that tail end of that graph, we're rising again. So even though we've got all this vaccination out, and we're vaccinating faster and faster, what's also going faster and faster is the opening up of businesses and people doing more and getting together more. And we have these new variants out which spread faster, they're more contagious, they're much easier to spread. So it's a really head-to-head race between the vaccine and the spread of this virus. We're tracking lots of these different variants. They're identified through something called whole genome sequencing, where they sequence the DNA of the entire sequence of virus that's collected from a nasal swab. The state has labs that are doing this, and we've been sending samples ourselves to there's a lab over in San Francisco, and then we've just gotten online this past week our own whole genome sequencer, so we can do our own in-house sequencing. But so far, we're only sequencing a small percentage of all the positive tests. But what we've seen is, especially in the East Coast, there's been a lot of these variants. In California, not as many, but mostly we're seeing the California variant, which is felt to be about 10% more contagious. and it right now makes up more than 50% of all the cases in California are this California variant. The one that's most common across the U.S. is this UK variant, B.1.1.7, and in California there's been over 1,000 cases identified. That's still less than 10% of all the cases that are being sequenced in California. And the Bay Area, it's even lower percentage. The UK variant is concerning because it's about 50% more transmissible, so it spreads 50% easier. It also seems to cause more severe disease when people get sick with it. The other variants that are less common, but we're keeping an eye on, the Brazil variant, which is most concerning because people who have been infected with COVID before seem to easily get reinfected with the Brazil variant. And then the South African variant, which there's some signs that the current vaccines, there's slightly less effect. The vaccines still seem to work against the South African variant, but not quite as well. So those are all things that we're tracking. And the more overall spread there is in the community, the more these variants, because they spread more easily, they're going to more take over. But so far we're in better shape with these variants than other parts of the country because we've kept our transmission in the last couple of months lower than other states. And right now our case rates in California are something like, second, third, or fourth best of any state in the country right now. The way to end this pandemic is really through vaccination. No pandemic in history has ever been eliminated without vaccination. Natural immunity only gets you so far, and then the virus continues to spread. So until we get to community level of immunity through vaccine, which we don't really know what level that is going to be yet, we're not going to get this virus under control. The only country that's really successfully vaccinated their population against COVID and then opened up their society and kept case rates down has been Israel. And they started opening up when they got to about 60% of their population or 70% of their adults vaccinated. And even now they're still, have a lot of vaccine requirements to go to indoor dining or indoor gatherings. You have to show proof that you've been vaccinated. So no other country has gotten to that level of vaccination and opened up their economy yet. England is just starting to do it now. I think today they're opening up some of their severe restrictions, so we'll have to see how they go. But in Contra Costa, we're further ahead than most of the country. We're 58% of the adult population has gotten at least one dose. It's a little less than half of the total population. So we're still about 20% or about another 10% behind where Israel was when they started to open up. And as you know, we're already opening up ahead of that. This is showing, how quickly we're vaccinating, and we're really rolling out vaccinating more and more every day. So we're now doing about 13,000 vaccine doses across the county, and that's, by all vaccinators, whether it's Kaiser or John Muir or Contra Costa Public Health or some of the state vaccine sites like the Oakland Coliseum. We're vaccinating more and more every day. Which is great news. We've been fortunate in that we've been getting a lot of our vaccine directly as a federal supply through this federally qualified health center program. The feds have been sending vaccine to health centers, and we've got a lot of these federally qualified health centers through our county. So the county run health centers, we have 11 of those across the county from North Richmond all the way out to Brentwood. And then Lifelong Health Centers has several federally qualified health centers in West County and La Clinica has several in Central and East County, and all of those are getting direct federal supplies. So we're getting, 120,000 doses of vaccine a week now, and most of that from the federal supply. So that's really been helping us. There's been reports over the last few days about a decrease in the state supply, and a lot of other our neighbor counties are seeing a decrease in their supply this week, but we're seeing about the same amount this week as we had last week's due to that federal supply. So we were able to make up for the decrease we're getting from the state, which is great. But there's still challenges. This is a map of where the vaccine rates are in people age 50 and older. Age 50 and older have been eligible to get vaccine for several weeks now in our county. And the red areas are the areas that have low rates, have rates in the 40s or 50% of people age 50 and older getting vaccinated, whereas the yellow areas have rates up in the 80 or even 90 percentile rates. So this represents some of these communities in red are poorer communities, more disadvantaged communities have less access to healthcare, but also there's some communities like in the Far East that are just they're a little more rural, they're a little maybe not less disconnected, but also they are a little more tend to be conservative, and we've seen some of the issues about some of the highest rates of vaccine ambivalence or vaccine hesitancy are in more conservative, politically conservative groups. So that we're seeing a political divide between the people's interest in getting vaccine, which we haven't seen before in previous vaccines. So let me step back a little bit and talk a little bit just about basics of COVID-19. So COVID-19 is a virus. It's part of the family of viruses known as coronaviruses. This is different from the influenza virus family. There's other coronaviruses we know about. The SARS virus that broke out in Asia and actually made it all the way to Santa Clara County a few years ago, was very deadly, but had very little asymptomatic transmission. So it was a lot easier to identify and stamp out. Similar with MERS, which was the Middle East respiratory virus, which also was very deadly but didn't spread as easily. But also common cold viruses and do spread very easily. So it's a wide range of different viruses in this family. What's the big challenge about COVID is not only does it spread so easily, and there's a wide range of how sick people get. Up to 40% of people have no symptoms at all, and yet other people get severely sick and can die from it. So it's just a tremendous range of how it expresses itself. And one sign of how contagious and how easy COVID is to spread is this past winter, with all our social distancing and masking and emphasis on hand hygiene, we basically eliminated influenza, the flu. There was no influenza throughout the US last winter. So these steps we were all doing, masking and social distancing, were so effective in totally eliminating the flu. And yet, despite that, we had our worst, winter surge of, COVID ever. So all those steps were not enough to prevent a really bad winter surge. And people do need to isolate for 10 days once they're diagnosed, 10 days from when their symptoms started, or for someone without symptoms, 10 days from when they tested positive. There's a few cases where someone who has a compromised immune system was very, very ill, where we recommend 20 days because they may have a harder time clearing the virus. But for most people, it's 10 days. It's also 10 days to quarantine if you got exposed, because those are the 10 days where you might develop COVID and might pass it on to other people. And these vaccines that were developed super fast, but they really didn't cut any corners. What they really did is they traded basically money for time. So money was no object in developing these vaccines. So generally, traditionally, a company would develop something, test it, and not until the tests and the clinical trials showed that they worked would they actually start building the manufacturing capacity to manufacture these viruses. But by the federal government guaranteeing that they would purchase millions of doses even before we knew that the vaccines would work, the companies were able to start that high level production even before they knew they worked or not. So they basically traded money for time. And we now have 3 different vaccines: Pfizer, Moderna, and the Johnson & Johnson. They have not been compared head to head, so it's really hard to state which one is the best. We know all of them are essentially 100% effective in preventing hospitalization and death. Some people focus on the percent in preventing infection or preventing symptomatic infection, and the numbers are different there, but it's a little apples to oranges comparison, because the Johnson & Johnson vaccine, even though that number is a little lower, the Johnson & Johnson was studied more over the late fall and winter when there were a lot of these variants going around that we know are a little easier to spread and cause more severe illness. So it's really hard to say whether one is necessarily better than the other. They're really all some of the best vaccines we've ever had as far as how effective they are. For example, the flu vaccine, in a good year, it might be 50% effective in preventing the flu. And so, these are much far and above more successful than that. And the technology they use, it's somewhat new, but not that new. So the mRNA technology that's in the Pfizer and Moderna vaccines, it's been studied for more than a decade. This adenovirus technology for the Johnson & Johnson vaccine, it uses this a harmless virus to trigger the immunity, and that was tested in many vaccines before for HIV and Ebola and others. So it's been studied and trusted. So the vaccines basically, expose the immune system to proteins from the virus and trigger the immune system to develop antibodies against those proteins. And they develop such a high level of antibodies that it's better than and more long-lasting than natural infection. And even with some of these variants, it's such a high level that it's still effective against those variants. We now know at least 6 months these vaccines can last, and it's probably going to be more than that. When will we need boosters? At some point, will it be like the flu shot? Will we need a booster every year? Or will it be like a tetanus shot where you'll need a booster every 10 years? We don't know. I know the manufacturers are working on sort of updated versions in case we need a booster to that really incorporate these new variants so that they're extra strong against the variants that are going around. I expect we'll probably need a booster, but it's just how often we don't know. And I'm pretty hopeful that it'll be less often than once a year. But again, only time will tell. Now, there are some minor side effects from the vaccines, and it's very, very rare to have any severe side effects. Allergic reactions are around 2 to 5 per million doses, and that rate's been pretty steady ever since we've been rolling out these vaccines. And that's why we have people stick around for 15 minutes after their shot, just to make sure they don't get an allergic reaction, because most of those allergic reactions happen, right away. Usually somebody might have to go to the emergency room maybe get some Benadryl, maybe get like an EpiPen, and then go home. But those are extremely rare. More commonly, people get sore arm, feel a little tired. Some people get a fever or chills. Usually those last 1, 2, the most 3 days. Sometimes it's a little worse after the second dose for the 2-dose vaccines. But then usually by 2 or 3 days, it's worn off. So who can get COVID vaccines? Well, in our county, it's everybody now. Everyone age 16 and older. So whose turn is it? It's your turn. So anyone who lives or works or goes to school in Contra Costa County is eligible, both through our county-run sites as well as the Oakland Coliseum is a site that's jointly run now by Alameda County, Contra Costa County, and the state. And on the 15th, which is this Thursday, all other state sites and other counties are also going to open up to 16 and older. So we're a little ahead of some places in opening that up to everybody, but that just makes it a lot simpler. We have a page on our website that lists all the different places that you can sign up to get a vaccine. There's some pharmacies are doing it. Some have their own scheduling systems. We have links to all of them. The most important have the blue arrows in them. So this is where the majority of vaccines in our county are being administered, either through our county scheduling system or through the My Turn, which gets you to the Oakland Coliseum and some other state-run sites. But for folks who are really persistent and want to try every single option, we have links to all of those. Currently, the way it works is you fill out a form online, you submit it, you'll get a confirmation email, and then you'll get an invitation to schedule through your email, and then you can schedule the appointment. We also have a phone line that for people who prefer not to use online or have trouble navigating online. We do have a lot of high call volumes, but we do have a system where people can leave their number and get called back instead of staying on hold. But our current wait list is actually now down to about 2,000 people, which again, we're vaccinating about 13,000 people a day. So that's less than a day's wait. So most people are actually getting their invitation to schedule within a day or two after signing up. And actually this Thursday, we're going to simplify it even more, and it's going to be a direct scheduling system. So you go online, and right there you can see the locations and dates and times, and you can just schedule your appointment right away. You don't have to submit something and get on a waiting list. So we're essentially eliminating our waiting list on Thursday. And then which vaccine will somebody get? Well, at this point, with the supplies still tight, and we're really getting different amounts of vaccine each week, and we're shuffling them around to all of our different sites. We can't really promise anyone any one particular vaccine. We really are using all of our vaccine at all of our sites, and we think they're all equally really good vaccines. The Johnson & Johnson, the main difference is only 1 dose. I like to say it's such a good vaccine that you only need 1 dose, whereas the other 2 vaccines require 2 doses. But the only place we're using the vaccines differently is more of a logistics issue. So the Pfizer needs an ultra cold storage. So there's some places that aren't able to handle the Pfizer vaccine. The Johnson & Johnson, because it's a single dose, it's really helpful for hard to reach populations where we might have difficulty coming back for a second dose. So our homeless outreach teams are using that for homeless individuals. Some of our kind of community pop-up sites are using that, but it's more of a logistical reason. It's not because one vaccine is better than another. And really, we think about this sort of Swiss cheese approach. The virus, we want to create as many barriers as possible. Vaccine is the best and most important barrier, but it's not 100%. And so there's still all these other important things: maintaining your distance, hand hygiene, hand sanitizer, washing your hands, wearing masks, staying home if you're sick, avoiding crowded indoor spaces, regular testing to pick up asymptomatic infection. All of those things help the individual and help our community, reduce the spread of COVID. How does life change when you're fully vaccinated? Well, first of all, what is fully vaccinated? It's really when you're at least 2 weeks after your last dose of vaccine. That's when you get the full effect of the immune system boost. And so life can change. So you can feel comfortable visiting indoors with other fully vaccinated people and not having to wear a mask. You could even visit indoors people who aren't unvaccinated if they're at low risk. For example, grandparents can now see their grandchildren and visit with them and hug them, kiss their grandchildren. You can travel domestically without having to test beforehand or quarantine after. And some international travel is starting to open up. We still recommend, if you're indoors, like an indoor restaurant, still wearing a mask, because there's, still you're going to be around people who may not be vaccinated. Still, you recommend a lot of caution around medium or large size gatherings of a lot of people who aren't vaccinated. Now, the state is updating its rules about gatherings. So currently, talking about private gatherings, which the state defines as, social informal get-togethers where you don't have a defined guest list. So currently, only 3 households are allowed. Preferred outdoors. Outdoors is always safer. But starting on Thursday, the state's rules will allow outdoor gatherings up to 50 people. And then indoor gatherings, although they're still discouraged, they're allowed up to 25 people or 25% capacity of a space, whichever is less. And then private events. And I know there were questions about when can the men's group start getting together in person. So private events, that's a more structured, like a meeting, a conference, a reception. Those are allowed starting Thursday in the orange tier, which we're in now. Outdoors up to 100 people. And then if the event is structured so that all the guests are showing proof of vaccination or a recent test, you can actually increase that capacity up to 300. And then indoor, only if all the guests are tested or showing proof of vaccination can a private event meet indoors, and then it can be up to 150 people. If you don't have that testing or proof of vaccination, then you have to fall back to the kind of private gatherings, which would be 25 people indoor max. And then the other things that are required for this private events to happen, for those larger capacities, numbers of people, is it's got to be advanced tickets, a defined guest list, a seating chart with assigned seating, not mixing multiple events side by side or one after the other. When this first came out, there was a lot of emphasis on symptom screening and temperature screening, and there's really been a lack of evidence to really support those. In large part because so many people are asymptomatic transmitters. So, the temperature screening or symptom screening is not going to pick up those 40% of people who don't have symptoms. So we're really not requiring that or feeling that's really adding any level of safety anymore to any kind of events or businesses. And then what comes next? So California announced the plan to fully open on June 15th, totally lifting the blueprint and all the business restrictions. There's still going to be plans for requirements for masking, and there still will be probably some requirements on large, very large gatherings. But other than those things, the state's planning to really lift the business restrictions June 15th, assuming our hospitalization rates stay low, assuming we can continue to vaccinate between now and then at a high rate, and assuming we're not seeing any worrisome signs about people who have been vaccinated getting really sick or hospitalized. So with all those caveats, we're kind of looking forward to June 15th, when most of the community is vaccinated and protected, and we can start getting more back to a more normal life. So, but in the meantime, still prevention is our best tool. A vaccine is the best part of prevention. So hopefully most of you have been vaccinated, but encourage you to encourage your friends and family members who haven't been vaccinated to get vaccinated for their own protection, as well as the protection of those around them. We now know, pretty good in mounting evidence that people who are vaccinated also don't spread the virus as much as somebody without vaccines. So getting vaccinated not only protects yourself, but it protects others around you. So I'll stop there, and let's see, stop the sharing there, and then I can try to
Dr. Farnetano, thank you for answering many of our questions. There are a couple follow-ups on areas that are important for SIR.
Yes.
So our organization is largely an activity and social organization. And, Branch 8 gets together periodically, usually monthly, at the Concord Hilton. And Branch 146 gets together at Boundary Oak. And you kind of indicated that there would be a potential for these in-person gatherings maybe toward late summer and fall. Is that fair to say?
Yeah, that's definitely fair to say. Really, even after April 15th, with those sort of requirements in place, you could have a gathering. You'd have to organize it with assigned seating, and you could have up to 100 people outdoors. If you wanted to do it indoors, you'd have to have us come up with a system where everyone showed proof of vaccination or testing. But then after June 15th, presumably, then those requirements would be lifted, and groups could gather more normally without having to go through all those extra steps.
Now, some of our gatherings are smaller. We have groups that dine in at someone's home or perhaps dine out at a restaurant. What precautions should be taken for those kinds of gatherings, and how quickly can we get together with 20 or 30 in a group indoors?
Yeah, and so, the biggest risk is really around the food and drink, because that's when people are taking their masks off. And so it's still really important that if there is especially an indoor meeting with food and drink, that people are kind of sitting at least 6 feet apart from each other while they're eating, while their masks are off. Again, if you can structure it to eat outside or meet outside is always safer. Keeping the group small is always better. Again, indoors is allowed after Thursday, up to 25 people, or 25% capacity. It's a little hard to calculate capacity in a private home, but keep small indoor gatherings are allowed. But again, trying to keep people spaced far apart, trying to do things outdoors, maybe meet indoors with masks, but then have your meal outdoors if possible. Every step kind of helps reduce the risk.
What's your assessment of the tiered structure? I've heard from some people that it's added confusion, other people it's added clarity. What's your assessment of it?
Well, again, when we started back in last spring, the state didn't have any rules, and local health officers, we came together and we crafted the stay-at-home order, and then the state, followed shortly after that, and then you know we had an attempt last late spring, early summer to try to open things up, and that led to the summer surge. And so, locally and in the statewide, we had to put in extra restrictions. I think the states kind of gradually caught up, and more the local health officers have been able to align our local restrictions with the state, and that's helped to have one set of rules for people to follow. And it still was an experiment because this was all new to all of us. We didn't know how much we could open up and still keep transmission under control. We saw in the fall that the blueprint still wasn't strict enough, that as we were, even though we thought we were opening up more slowly and more cautiously than we did in the spring, it still led to this surge in November, December. Now we're doing it one more time, but we have something new, which is the vaccine. And we've gone further than we did in the fall. We've been in the orange tier now, for several weeks, whereas in the fall we were barely in orange tier for a week before the cases started going up again. So we're doing better, and the state as a whole is doing better. But again, we're still right on that. We're right on that cusp. We're right on the sort of knife's edge between opening up too quickly and the virus spreading, and getting that vaccine out there and keeping things down. And so, where will we fall on that knife's edge? Will we see another surge, or will we keep the vaccine keeping just one step ahead of it? So I think we could not have stayed in lockdown for an entire year, for businesses, for people's mental health sanity and everything. And so this was an attempt to try to do a measured response. And it wasn't by any means perfect, because we were all learning as we went along. But I think the good news is we have a lot to look forward to about getting more and more back to normal now.
How have you been trying to coordinate things with other counties? Because counties have been at different tier levels and different messages, and how has that worked out?
Yeah, we've worked really closely, especially across the Bay Area, with our Association of Bay Area Health Officers. And we, before the pandemic, we would meet once a month or every couple of months. But when the pandemic started, we've been talking, meeting, emailing, on Zoom calls, at times, several times a day, at least several times a week. And so we really do that. I've got another call with my colleagues this afternoon, in fact. And we try, we've tried to really coordinate as much as possible. It's been, sometimes challenging, sometimes not. But we've been trying to, especially in the Bay Area, align our approaches as much as we can. And again, to have some clarity of messaging. If we can do things together, we're stronger together. It's more effective messaging. We've felt at several stages where the state wasn't reacting quick enough, and so we stepped in to put in restrictions ahead of the state. I think that really paid off with this winter, where we went into our regional stay-at-home order a few weeks before the state imposed it, and that made the difference between what we saw in the Bay Area and Southern California, between hospitals getting overloaded and not. So we try to coordinate when we can. Sometimes we coordinate on messages, sometimes we coordinate on restrictions. But we're each independent entities, each independent counties. So sometimes we kind of disagree on some of the details, but we try to stay aligned on the big issues.
Now, you mentioned the vaccine hesitancy. So what's being done to kind of overcome that and reach those people who might be hesitating?
Well, I think a lot, some of it's education, some of it's information, some of it's using trusted messengers. And so we've, to address vaccine hesitancy in the African American population, there's been a long, history of distrust of the healthcare system due to, discrimination and unfair practices and unequal treatment among African Americans in healthcare in this country for decades. And so we've worked with trusted messengers, some of our Black physicians talking about why they got the vaccine, working with Black ministers, working with other community agencies, our Latino community, working with community-based organizations that are trusted by them. And so really making sure that it's not just the message, but the messenger is someone that can be trusted. Some people don't trust the government. They don't trust the public health department. It's a government organization. So now we're actually getting to the point in the vaccine supply where we're able to start working with primary care doctors, family doctors, so that maybe you don't trust the public health department, but you trust your own doctor. So maybe you'll take the vaccine from your own doctor. So we're starting to share the vaccine with the primary care providers, so that they can be the ones delivering the message and delivering the vaccine. And we're trying to adapt our message as we go. Early on, a lot of the concern was marginalized communities, Black and brown communities, but now we're also seeing, conservative white communities being hesitant as well. So there's a different message we need to bring to them. They have different reasons for being reluctant, and so we have to pivot our message and target our message.
Yeah. Now, you mentioned some short-term side effects from the vaccinations, but we hear about these long haulers, people who've had COVID, and they have the lingering effects. So say more about that. What do you attribute that to?
Yeah, and we're learning more about that all the time. We do know that the more severe your COVID illness was at first, the more likely you're going to be a long hauler and have some of these long-term side effects. Although there have been cases of people with very mild COVID early on who still get the long-term side effects. So it's not a direct, but your risk is definitely higher the sicker you were when you started. And COVID, we know it doesn't just affect the lungs. I mean, that's the most common and most severe symptoms are causing severe pneumonia and respiratory failure. But COVID affects nerves, it affects the brain, it affects the immune system. So we're seeing things like nerve damage, trouble with memory and concentration. We've seen problems with blood clots in people, really due to immune system reactions. And some of these things have been showing up in some of these long-term symptoms. Over time, month by month, people's long-term symptoms tend to get better or go away. So most people continue to see improvement. There's been some encouraging case reports, there are just really a handful of them, of long haulers getting vaccinated and then their symptoms going away. So that's, it's too soon to really say for sure that's a real thing, but it's encouraging, and they're doing more research on that.
Sure. One is many of us would like to get out and travel again. What do you think about traveling, and if so, under what conditions?
Yeah, I think traveling, if you're vaccinated, I think is reasonable to consider. I would still kind of advise, it's how you travel. So, avoiding indoor restaurants, eating outdoors, avoiding large crowded gatherings, trying, if you're around, traveling to visit, family or friends that are not vaccinated, still wear masks or, meet outside. Um, so I think it's what you do when you travel. Traveling in an airport, you know, just wearing your mask through the airport when you're boarding the plane. Um, that's when you're really closest to a lot of people. And then, keeping your mask on throughout the flight. But I think it's certainly for people who are vaccinated. I think traveling, especially domestically within the U.S., is a lot safer than it was before a vaccine. And then internationally, I think some of it depends on what the state is in that particular country, what the travel restrictions are, and what the medical system is. So they're traveling to a country that's being overwhelmed by COVID, and their hospitals are overwhelmed. You wouldn't want to travel there, and then you have a non-COVID medical problem, and the health system can't care for you.
And a final question. This is such a fast-moving situation. How do you recommend we stay informed and keep up to date as to things changing?
Well, I think the CDC website is always a great source of information. And then, I'd recommend our own county health department. We have our COVID page, cchealth.org/coronavirus. And we're always trying to keep that up to date with all the newest information. So I think those are two great, sources of information that try to be factual and up to date.
Dr. Farnatano, thank you very much. Pleased
Steve,
to have you as our guest.
Steve, can you hear me?
Yes.
Before he leaves, I had the one question at the end. I'm still not clear. If everybody's been vaccinated, say there's 25 men that have been vaccinated already, fully vaccinated, we get together at an indoor meeting. What is the danger in not masking or not distancing?
So it's very low. It's not zero, but it's very low. We have seen cases of that fully vaccinated people catch COVID, especially some of these variants like this UK variant. So there's been cases in our county where fully vaccinated people have gotten the UK variant, but their symptoms have been very mild. So that's a reassuring thing, is that, if you're vaccinated, you still might catch COVID, but most likely you're going to have no symptoms or very mild symptoms. And so, so everyone has their own particular level of risk tolerance. But, meeting 25 people or less indoors, fully vaccinated, without masks, you're still at low risk. But again, the masks add an extra layer of protection. So it's somewhat to an individual's level of kind of what their risk tolerance is.
But isn't that going to be forever then?
Well, we don't know. Yeah, it's all new, so it's hard to say forever for anything. Thanks you.
For attending. Thanks, Dr. Farnatano. And thanks our technical guys for supporting, and all our guests. I hope you found this informative, and have a good week. Thank you, guys.